Hello everyone, welcome to Dr. Lee's Evidence-Based Integrated Medicine, a place where Asian wisdoms meets modern science. I'm your host, Chi Chen. I would like to dedicate this episode to breast cancer survivorship, addressing those who have been diagnosed with breast cancers and are currently battling the disease or have recovered from it. In the first episode, I would like to address the rationale of lifestyle modifications that could improve clinical outcomes, including measures to enhance survival or reduce cancer recurrence. In the next episode, I will spend more time addressing the management of side effects from breast cancers or its treatment, including those arising from hormone therapy or chemotherapy. So what are some unique features of breast cancers? Thanks to today's medical technology, the survival rate of breast cancer has improved significantly. So patients' functionality and quality of life following the treatment becomes more and more important. Managing the side effects such as fatigue, peripheral neuropathy, or joint pain from aromatase inhibitors are all crucial to maintain the quality of life for patients. The other feature of breast cancer is that the majority of breast cancer are hormone sensitive, meaning that they are affected by the blood estrogen or progesterone level. Therefore, we should strive to have lifestyle modifications that can reduce the estrogen and progesterone blood level, and which could potentially affect the outcomes. There are a lot of interventions have been studied, including maintaining healthy weight, adapting to low-fat diet, and avoiding alcohol, avoiding high sugar, and avoiding highly processed food. It's worth mentioning that exercise being one of the most powerful interventions to reduce cancer recurrence and reduce side effects. We'll talk about the evidence shortly. You probably will see this graph multiple times. Those are the 10 interventions for cancer prevention proposed by the World Cancer Research Fund and the American Institute for Cancer Research. I would say that from the perspective of breast cancer prevention, there are several interventions in this graph are particularly crucial. Those including being physically active, maintaining a healthy weight, limiting alcohol consumption, and reducing the intake of sugar and sweetened beverages. Alright, so let's dive into the evidence of nutrition and weight. In this section, we'll talk about the healthy weight, the dietary pattern, and some specific foods that have anti-cancer properties. Are any dietary patterns such as Mediterranean diet, keto diet, low-fat diet, or format diet, are any of those that could improve outcomes in patients diagnosed with breast cancer? The most studied diet pattern in this setting is low-fat diet. So what do you mean by low-fat diet? A low-fat diet often involves reducing the total calorie intake from fat to 15 or 20%. As a reference, the WHO recommends the total fat consumption per day should not exceed more than 30% of total calorie intake. The mechanisms behind low-fat diets, including benefits such as lowering circulating hormones, improving insulin sensitivity, reducing inflammation, all of which are important in reducing cancer recurrence. So let's talk about some studies. The first large randomized control trial was conducted in 2006, involving 2,400 women with a resected early-stage breast cancer receiving conventional cancer management from 39 medical centers in the United States. They were then randomized into two groups. One group following a low-fat diet, indicating that they can only take 15% of daily calorie intake from fat, and the other serving as the control group. The median follow-up period was 60 months. Overall, there was no difference in survival between the two groups. However, the low-fat group has lower breast cancer recurrence, with a hazard ratio of 0.76. If we break down into the different subgroups, we can observe that patients who benefit from low-fat diet are those who are estrogen receptor positive, as opposed to those who are estrogen receptor negative. So following the initial trials in 2006, this trial published in 2018 is a secondary analysis of the WIN-DM trial. Initially, there are a total of 49,000 postmenopause women with no history of breast cancers that were randomized into two groups. One receiving a 20% of low-fat diet and the encouragement of vegetable consumption, while the other serving as the control group. So during the 8.5 years of follow-up, there's a total of 1,700 women were diagnosed with breast cancer. Among them, those who were in the low-fat group had an overall better 10-year survival rate by 4%. The hazard ratio for the low-fat group was 0.78. In the subgroup analysis, however, we did notice that the majority of benefits is from reducing the deaths due to cardiovascular disease. The benefits from reducing deaths related to breast cancer or other cancers did not reach statistical significance. Once more, there are more benefits observed for patients who has breast cancer with estrogen receptor positive status. How about plant-based diet? I'm a personal believer of a plant-based diet. So in addition to fibers, plant-based diet is rich in micronutrients and antioxidants that are beneficial for overall health. However, in the setting of breast cancer, a plant-based diet alone may not be sufficient. This study was conducted as a multi-center randomized control trial in the United States. There is a total of 3,000 women with early-stage breast cancer and were randomized into two groups. One group receiving a high vegetable diet, which include a telephone counseling program, supplemented with the cooking classes, and promoting 5 servings of vegetables and 3 servings of fruits per day, along with the encouragement with a low-fat consumption. The other serving as the control group. At a 3-year follow-up, the plant-based diet group did consume an average of 5.8 servings of vegetable and 3.4 servings of fruits. That is much more than I eat every day. However, there was no difference in the 10-year survival between the two groups. Although there are critiques of study design, such as not addressing the patients with different BMI, overall, I still think this study is quite rigorous and well conducted. I would say that in terms of dietary pattern that would be beneficial for patients with breast cancer, I will advocate for low-fat diet, which includes 15 to 20% of total calorie from fat per day. Alright, let's discuss healthy weight. So maintaining a healthy weight entails that keeping your weight within a certain healthy range, avoiding being too low, which could lead to frailty and insufficient muscle mass. You also don't want to be too high, which could result in excessive fat accumulation and increasing circulating hormones. This is a study that published in the Annals of Oncology, analyzing 82 studies involving 0.2 million breast cancer survivors. Overall, there is a U-shaped relationship between the BMI and overall survival. For each increase in BMI by 5, there is a 17% increase in mortality. Here I'm talking about the BMI prior to the breast cancer diagnosis. So even after cancer diagnosis, there's still an increase of mortality by 11% within 1 year of diagnosis and 8% after 1 year diagnosis for those who have a higher BMI. On the other hand, the survival rate is incrementally lower as well when the BMI is less than 20. Based on the study, I will say it's never too late to implement weight management through exercise and diets to have a BMI target at 20 to 25. I know that in this graph you can see also maybe after 1 year of treatment, the BMI can be 25 to 30. Generally, I will try to maintain a healthy range with a good muscle mass and a BMI of 20 to 25. How about specific foods? When it comes to specific foods, there is a spectrum of anti-cancer foods known for their anti-cancer properties. While the evidence in breast cancer is somewhat limited, I would say the cruciferous vegetables such as broccoli and Brussels sprouts have shown evidence in reducing cancer recurrence, especially for patients who are taking the tamoxifen. To maximize the benefits for cruciferous vegetables, I will suggest consuming these cruciferous vegetables when they are raw and uncooked. If you want to cook them, I would suggest that you chop them first and allow them to sit for 40 minutes before cooking. While cooking them, I will say to avoid using high temperature, exceeding 70 degrees Celsius for more than 10 minutes. How about mushroom? In the realm of mushroom, there is some in vitro evidence suggesting that maitake showing anti-tumor property and activity against triple-negative breast cancer. I would suggest to consume maitake mushrooms in moderate amounts. Unlike cruciferous vegetables, all the mushrooms should be cooked, and we'll dive into the rationale for those in more details in the future. Green tea possesses natural aromatase inhibitor properties. Despite limited evidence, incorporating green tea at moderate amount into daily routine is unlikely to be harmful. After consuming the first cup of tea, you can continue to add more water throughout the day as the green tea leaves gradually release the antioxidants through the subsequent cups. This is the table of my recommendation. How about essential fatty acids and soy products? Essential fatty acids such as omega-3 are renowned for their anti-inflammatory properties, but there's limited evidence supporting their role in secondary prevention in breast cancer. Omega-3 is primarily found in fish, and the WHO recommends consuming 2 servings of fish per week. For more details on omega-3, you can refer to my YouTube videos. When selecting cooking oils, I still hold the same opinion that olive oil is the preferred choice for cooking. Okay, here comes to the big one, which is the soy products. There have been considerable controversies surrounding the soy products. The concern initially raised when the compounds like equal in soy products that could act as estrogens-like material that stimulate the tumor growth. However, it has now become clear that soy products act as estrogen modulators. Soy product is binding preferably to the estrogen beta receptors instead of the estrogen alpha receptors. In many clinical studies, soy product use actually is associated with improvement of breast cancer outcomes. It's important to note that most of the studies that show benefits have been conducted in Asian populations. And it's worth noting that individuals of non-Asian population have a lower metabolic activities of the gut enzyme needed to metabolize isoflavone, which is the primary ingredient in soy oil. So while you take enough amount of the soy product as Asian population, because of gut enzymes that are less, you may not achieve the same benefit. Consequently, the soy products may not be as effective for patients of other ethnicities. I recommend incorporating soy products in moderate amount, such as edamame, tofu, or soy milk, into the diet. However, I do not recommend taking the isoflavone as a diet supplement, as it lacks direct evidence. Alright, let's dive into diet supplement. Should we use diet supplement in breast cancer? The Society of Integrated Oncology suggests that there is insufficient evidence to support the use of diet supplements in breast cancer treatment. Therefore, the caution should be exercised when considering their use. And I would say in particular, like antioxidant supplements such as vitamin A, vitamin E, or coenzyme Q10 could potentially interfere with the chemotherapy or radiation therapy. They also report that high dose of B12 or iron supplements may result in poor disease survival outcomes. So while these supplements may help with the fatigue and general health conditions, they should not be used in patients with breast cancer. It's important to note that the multivitamin supplements have not been associated with better or worse outcomes in breast cancer. There are, however, two supplements worth considering use in patients with breast cancer, and those are vitamin D and curcumin. While the evidence supporting the use of vitamin D in breast cancer survivor is limited, I would recommend that patients with vitamin D deficiency take supplements to bring their levels back to normal, as it can exert multiple health benefits. Additionally, there may be a role for the vitamin D supplementation in patients experiencing joint pain from taking the aromatase inhibitors. Curcumin is the active ingredient found in turmeric and is a promising antioxidant herbal supplement. Although evidence is limited, I will consider its use for patients with other comorbidities that could benefit from its anti-inflammation effect. However, I will exercise caution using curcumin for somebody who is actively receiving the chemotherapy or radiation therapy. Alright, let's talk about one of the most important interventions, which is exercise. Exercise is the most important modality in breast cancer patients. It has multiple benefits, including improving immunity, reducing inflammation, adjusting the microenvironment of the tumor growth, and maintaining the vessel integrity so that reducing the chance for the tumor to spread. Exercise can also lower the circulating hormones such as estrogen and progesterone level. The guideline by the American Society of Sport Medicine provide exercise guidelines for cancer survivors. As you can see the table here, exercise can potentially have a benefit in reducing anxiety, reducing depression, improving quality of life, and reducing fatigue. And I always advocate the combination of aerobic exercise and resistance exercise, which I believe having a synergic effect on overall well-being. When discussing exercise with patients, I approach it as I would like any other medications, and I will give an exercise prescriptions. This means that setting up a clear, achievable, and measurable goals with the patient together. The following regimen is the default and most studied exercise regimen. So generally for aerobic exercise, we aim for patients to achieve 150 minutes of moderate exercise every week, or 75 minutes per week of vigorous exercise. While moderate intensity refers to being able to achieve 70% of maximal heart rate. If the patient prefers not to monitor heart rate, I will suggest to exercise to a point that when one can speak words, but then not complete the full sentences. And that is intensity needed for a person to achieve moderate intensity. And for those engaging in vigorous activity again, I will recommend the duration is 75 minutes per week, although achieving those activity will require better physical condition. For patients who are frail, I will tailor a plan specifically to their needs and gradually increasing the exercise intensity as well as duration. Overall, any exercise is better than no exercise. For resistant exercise, I suggest a frequency of 2 times per week and 70% of maximal RM for 2 to 3 sets. Resistant exercise has different benefits than aerobic exercise, effectively preventing the loss of muscle mass and building up the physical stamina. Lastly, neuromotor exercise such as yoga has been well studied in breast cancer survivors. It has many benefits in alleviating cancer side effects, which we'll discuss in the following episode. It's important to say that many breast cancer patients are chronically fatigued and have a depletion in yin energy. Yoga, like yin yoga, which could help patients to restore their yin energy, and that could be quite helpful in relieving the fatigue. There are many studies that showing the benefits of exercise. One study that assessed the California teachers with invasive breast cancer found that the patients who participate in moderate activity had a significantly reduced mortality, with a relative risk of 0.53, which is profound, and I would say that is much better than other medications that we use in the conventional medicine realm. Alright, in the last part, I just want to briefly mention the managing side effects for patients with breast cancers. There are many associated side effects with the breast cancer itself or from the hormone therapy or chemotherapy that will include fatigue, cognitive dysfunctions, nausea, vomiting, hot flush, menopause symptoms, or pain. The pain can be generalized pain, neuropathy-related pain, or pain from the aromatase inhibitor use. And this is the realm I would say that the integrative medicine potentially have a huge role, as many of the side effects lack of effective conventional medicine. And then as you can see here, there are many modalities that can help with a variety of conditions, including exercise, acupuncture, yoga, CBT, hypnosis, and there are also some herbs like American ginseng for fatigue, ginger root for nausea vomitings, and I will dive into those in the next episode. Thank you for your attention today.